Good evening, good afternoon, and good morning from wherever you're listening to us from. A very warm welcome to today's webinar on the topic, Putting Health at the Center of Climate Action. We want to focus on the outcome and achievement of COP28, which was the first COP28 Health Day, which was held on 3rd December this year. So my name is Dr. Jijo. I'm the chair of KMA Planetary Health Committee, and this webinar has been organized by KMA Planetary Health Committee, with us, which is a committee that deals with the nexus between climate change and health. Our aim as a committee is to raise awareness on this crucial nexus between health and climate change at the community level and also among the healthcare workforce. Our other objective is to be able to build an adaptive and resilient community and healthcare workforce and healthcare system that can be able to respond to climate-induced health risks and challenges. Today, we are privileged to have one Dr. Bansal, who is an internal medicine physician from South Florida in the United States of America. He is a clinical assistant professor of medicine at Florida International University in Miami. Dr. Bansal is also the chair of a working group on environment at the World Medical Association, and he has previously served as the co-chair for World Medical Association at COP27, which was held in Egypt, Sharm el-Sheikh. This year at COP28, he was a board member of the Physician for Social Responsibility, and he has equally served as an affiliate of the International Physicians for Prevention of Nuclear War. Dr. Bansal also doubles up as a member of the Council on Science and Public Health at American Medical Association. So he comes with a wealth of experience on this crucial topic. And for those who know, WHO has postulated that the biggest threat facing humanity and the biggest threat to global health currently in the 21st century is the threat of climate change. And it has been postulated that between the year 2030 to 2050, if you don't do much, then you'll be able to experience about 250,000 additional deaths as a result of climate-induced health threats. So allow me welcome Dr. Bansal to take us through what exactly happened at COP28 and how far have we come as healthcare practitioners in trying to push for having a health day or at COP level. You will also be able to tell us a few outcomes and commitments that were made at COP28 Health Day, and also be able to paint for us a picture on some of the climate change-induced health risks that we're seeing globally. Welcome so much, my brother.
Thank you so much, Dr. Ojijo. And thank you, everybody, for joining today. I'm very happy and honored to be speaking to you today on this very important topic of climate change and health. I have a few slides. Let me just start those. Do you see the slide? Yes, okay, very good. All right, so as Dr. Ojijo mentioned, my name is Ankush Bansal. I'm an internal medicine physician in the United States in South Florida. I serve in several roles regarding climate change and health on multiple organizations, as you can see listed here, as well as at the American Medical Association. I do not have any conflicts of interest to disclose. So just as a background, why are we talking about climate change in healthcare? Why is that important? How is this any of our business? So the first thing to understand, if it's not already clear, is that mankind is influencing the climate. We have seen the studies, we have seen the science, that the human factors are significantly higher than the natural factors alone. And so far, globally, we have already gone up 1.4 degrees Fahrenheit. And our goal in the Paris Agreement is 1.5 degrees Celsius as a maximum by the end of the century from pre-industrial levels. So we're already headed in that direction as far as rising. And why is that important for health? Let me come back to that, but let me just back up and talk about the history of COP. So just a little bit of history here. In 1987, at the United Nations, there was the Montreal Protocol. This was the most important multilateral environmental treaty ever in history. In 1992, the member states of the United Nations joined a treaty that basically created the UNFCCC, United Nations Framework Convention on Climate Change. 2 years later, that went into force, and currently there are 198 member nations to the UNFCCC. In 1997, the Kyoto Protocol was adopted. This specifically limited and reduced greenhouse gas emissions as a mitigation strategy for climate change. That protocol, however, did not go into force until 8 years later. Currently, there are 192 signatories. And then the famous Paris Agreement was adopted in 2015 at COP28, and 1 year later, that went into force. And what the Paris Agreement discusses is several things. One, to limit global average temperature rise to less than 1.5 degrees Celsius from pre-industrial levels. That's where that came from, the Paris Agreement. Also, that there would be a 5-year cycle of NDCs. These are nationally determined contributions. So every 5 years, every one of those signatories will submit a report to the UNFCCC on what is being done in their countries to address climate change, to reduce global average temperature rise from their standpoint in different sectors. Unfortunately, health is not a requirement in the NDCs, and I will come back to that near the end of my talk. The Paris Agreement also addresses finance, technology, and capacity building. Currently, there are 195 parties to the Paris Agreement. In 2021, we finally had a health pavilion hosted by the World Health Organization at COP26 in Glasgow. That was the first time ever that there was a physical location where health professionals could meet and where we could present to all of the other delegates at COP the importance of health when discussing climate change. All the way, it took 26 years for that to happen. And then this year at COP28, 28 years since the first COP, we had our first health day. And what that means is there was a specific day, the 3rd of December, that was a thematic day where many of the activities, including negotiations, would discuss health and how climate change affects it. This included the COP28 UAE Climate and Health Declaration, currently signed by at least 143 countries, probably more by now. However, there were some notable exceptions, particularly India and China. So we'll see where that goes into the future if they sign or there are additional signatories. So why health? You know, regardless of location, population, practice setting, we all experience the effects of climate change. There's air pollution, water pollution, excessive heat, mental illness, infectious disease, trauma, displacement and migration, and then worsening and or reduced healthcare access for the chronic non-communicable diseases that we treat every day, wherever we are in the world. Air pollution, there have been many, many studies showing that asthma rates go up, COPD exacerbation rates go up, lung cancer, pneumonia, other respiratory infections. And then for mothers and infants, intrauterine growth retardation during development of the fetus, that also goes up if there are high PM2.5 levels. And if that is consistent during that pregnancy. It can also lead to low birth weight and even maternal morbidity. There are published studies all over the world, including the US, including in my part of Florida, where we have documented that when the PM2.5 levels go up from air pollution from various industries, we actually see the number of people who are sick and cannot go to work, or children who cannot go to school because of asthma exacerbation and COPD exacerbation go up. And it's very interesting because when those levels come down from whatever was causing that, within 2 to 3 days, the rates of absence, as well as the rates of hospitalization for these respiratory illnesses, go back down to baseline. And it's almost exactly matching when those pollution levels go up. For water pollution, diarrheal illnesses, malnutrition, lack of fresh water. Again, even in a high-income country like mine, we see this as well. Excessive heat, that can cause myocardial infarction, congestive heart failure exacerbation, acute kidney injury, chronic kidney disease, and or leading to end-stage renal disease and delirium. I personally have seen that in patients. I remember a few years ago on a very, very hot day during the middle of the summer, there was a 25-year-old man who was a laborer who worked outside in construction, had no health problems, no medications, no drug use, otherwise very healthy, became severely dehydrated, had to be admitted to the hospital for IV fluid rehydration, was an acute kidney injury, luckily did not lead to dialysis, did not lead to heart failure, did not lead to stroke, but he was hospitalized simply because of excessive heat. Mental illness, depression, anxiety, and then for those people who suffer through climate-related disasters, whether they are hurricanes, fires, excessive heat, floods, infectious disease outbreaks, many of them develop post-traumatic stress disorder type symptoms. Infectious disease, we are all familiar with this, vector-borne diseases. In my part of Florida, all of these that I've listed here, we all have these currently or throughout the year going on de novo, not from travelers, but the mosquitoes and the ticks are now in our area when they were not there even 10, 15 years ago. Zika, chikungunya, malaria, dengue, tick diseases like Lyme disease. We have all of those now spreading in parts of the world that never had these before. And these are all climate related because those mosquitoes and vectors are moving northwards or moving into areas where they did not exist before. Trauma from disasters such as hurricanes, fires, floods, and then as I mentioned, displacement migration, as we all are all familiar with even to this day, and then healthcare access. So this slide I took from one of my local climate groups, and this is a very good mnemonic to think about some of the climate impacts of health. It's heat wave, so heat illness, exacerbation of heart and lung conditions, asthma, traumatic injury, water and foodborne illnesses, allergies, vector-borne disease, and emotional stress or mental issues. And the reason this impacts is because of 4 areas that we can subdivide them in. And these are a little bit arbitrary, but a good way of thinking about how they impact health. There's the direct impact, spreading of disease, disrupting the food supply, and disrupting well-being. And another visual to show how this affects health. The additional categories here are environmental degradation, civil conflict, as we have seen, forced migration, mental health impacts. We have also seen severe weather causing injury, fatalities, and mental health impacts. And all of these are caused by the very well-known factors of climate change, even from a more general level, more extreme weather, rising sea levels, increased CO2 levels, and rising temperatures. And again, you see more hot days, you see more humidity in many parts of the world, longer, more frequent heat waves, and then you see all of these exacerbations. Now, the important thing is, there are certain populations of people in most parts of the world, whether it is high income, middle income, or low income country, that can to some extent adapt to this or get away from these kind of problems. But you also have to think about many of our other populations who are more at risk. Those are people who work outdoors, pregnant women, athletes, students, for example, in school or in university or professional athletes, those that live in cities who have less green spaces, young children, older adults, those who do not have air conditioning, those with any chronic condition, and then certain medications. There's many of these, for example, psychiatric medications, which you may be familiar with, that can increase the temperature as well as other side effects in people in normal conditions. And now if you're adding on these climate-related factors, these medications, while they're very good for treating the illnesses that they were meant for, they can actually exacerbate some of the harms from climate change. And again, temperature, global wind patterns, precipitation patterns, changes in relative humidity. And the important thing here in the changes in relative humidity, as we've seen in many parts of the world, is that it directly affects vector lifespans. So those mosquitoes and ticks, for example, It also affects the genetic composition of those vector populations, because now you're getting mixing of these different vectors that normally would not meet or be able to mix. And so you can create new diseases, or you can create resistance to types of diseases. There's also the change in the migration of those vectors and the length of the season. So for example, I am currently in South Florida. This December and January are our dry season. For the last several days, even while I was in Dubai for COP, it has been raining here almost every day. There have been some minor flooding, and this has affected the infrastructure, mainly communications, temporarily, but still. And so the important thing from the health perspective is that this is going to attract mosquitoes. So this could theoretically increase the number of vector-borne illnesses in the weeks to come, even though this is not the time of year where we would expect that. And again, another graphic showing how climate change affects physical, mental, and community health. Let me go to community health, since I've not talked about that. You know, when there's a lot of people who are all being affected by a common factor, and they have no faculty or agency to deal with that on an individual level, it can increase crime, it can increase aggression, it can increase violence because of their situation and because of the desperation that they're trying to get out of that situation. That leads to social instability, even within families, and decreased community cohesion. This is a very good quote. Mitigating climate change prevents unrivaled opportunities for improving public health. Just keep this in mind when I get to what happened at COP and what did not happen at COP. So what did we do at COP? So as I mentioned at the beginning, over 142 countries have signed the Health Declaration. Now, the Health Declaration has several pieces to it. You can pull that up online, but just basically what it says is that those signatories are, number one, agreeing that climate change directly affects health. Number two, that health should be a factor in accelerating the progress towards dealing with climate change, but also how they deal with climate change, including using an equity lens in everything they do. Number three, that this needs to be cross-sector. This cannot just be the Ministry of Health. This also involves environment, finance, commerce, transportation, education, all of those things. The next one is adaptation strategies, but also mitigation strategies. And that includes things like fossil fuel phase out. In addition, over 18 countries, probably more by now, have joined the WHO ATTACH initiative. ATTACH is the Alliance for Transformative Action on Climate and Health. This is separate from the COP Health Declaration. The ATTACH had existed prior to COP28, but we have additional countries that have joined this, where they will work with civil society organizations and governments at the WHO to come up with innovative ways to deal with the health impacts from climate change. There was also, for the first time ever at a COP, a ministerial roundtable. And at this ministerial roundtable, there were 50 ministers of health, many of whom had never been to a COP conference before. In addition, there were representatives from 24 additional health ministries. So either the deputy or assistant minister of health or other staff members from the ministry, even though the official minister of health or their equivalent was not present. So we had representation from at least 74 ministries of health there. And that was something that was profound. It was something that had never been done before. And in fact, my co-chair, who is the president of World Medical Association, she actually gave a 2-minute speech to these ministers of health, speaking from the healthcare perspective, speaking from the physician perspective, and speaking from the perspective of somebody who is a new mother of a 10-month-old. I recommend, if you can find it on YouTube, to definitely watch that. Because it is an amazing speech. And she was the only person from civil society that was given permission to speak at this ministerial roundtable. We also at COP28, in the very last moments, had some commitment to reduction of fossil fuel use. However, what we didn't do is get a commitment to phase out fossil fuels. The main goal of what was passed was cutting the emissions rather than the production, and it's reducing some of the production, although there were a lot of loopholes that were put into that. We cannot solve this climate crisis, and particularly from a health perspective, if we don't act on mitigation as well as adaptation. We must work on both, and mitigation means fossil fuel phase out fairly rapidly, but in a just and equitable way. So what are the next steps for the healthcare community? We must persist on educating and advocating to the policymakers after COP and before the next COP, and then thereafter on a regular basis at the regional, national, and international levels. It is one thing to meet with these policymakers and these ministers and government officials at the COP meetings, but these COP meetings only happen once a year. And, a lot of times at these COP meetings, the parties may agree to do something, but do they actually do it once they go home after COP is a different story. So I think we need to persist on making sure that we hold them accountable, number one. Number two, provide technical expertise to them. And what I mean by technical expertise is discuss what is the healthcare importance of this? How is it affecting our patients on a daily basis? How is it affecting their constituents? How is it affecting the economy? Because people who are affected by climate change from a health perspective are not able to go to work, not able to go to school, are sick, are needing to use the support services, that sort of thing. We also need action to the health of all constituents in the community, and the One Health approach. And the One Health approach, if you're not familiar, is not looking at it just from human health, but looking at it from human, animal, and environmental health, because it is all connected. For example, the vector diseases, but even the epidemics and the pandemics that come out, for example, COVID-19. And then the last thing that we need to work on, and we touched on this a little bit at COP28, is we need climate and disaster resilient health systems. There's been some work at a small scale in different parts of the world, from high income to low income countries that are amazing, but we need to scale this up so that we are ready for what will happen in the future from climate change, but even just from disasters. Whether they are man-made or natural disasters. We saw that during the COVID-19 pandemic, that the healthcare systems throughout the world were just barely able to deal with that pandemic. Now, if you add climate change effects and natural disasters from climate change on top of that, whether there's an epidemic or a pandemic, because at some point there will be another pandemic, then how are the health systems going to address that? The other piece of it is, for health systems, is to ensure that they work towards a sustainable and environmentally friendly practice. Currently, greenhouse gas emissions worldwide, 5% of that comes from health systems. In the United States, 8.5% of our greenhouse gas emissions come from health systems. That's a small amount in the grand scheme of things, but it's still very important to address, because our healthcare systems will only grow with our growing world population. And if there are more disasters and climate effects, there will be more utilization of those health systems. So we need to address that as well. So let me stop there and answer any questions. Thank you for this opportunity. You can also reach me afterwards. This is my email, but let me open it up to questions so I can address what all of you are most interested in. Thank you.
Thank you so much. Thank you so much for being precise. And I like the fact that you've addressed some of the issues that were of major concern at COP. Doc and I were at COP, and we were talking about the role of integrating planetary health education into medical school curricula. And I would want you probably to highlight what your thoughts are on this, especially considering that many of our attendees are actually healthcare professionals. And there's a knowledge gap on this nexus between climate change and health. And many of my colleagues who are asking me before this webinar is that, how can we ensure that those who are graduating from medical schools and those who are already into practice actually have this knowledge, and to ensure that we create a pool of more advocates, especially on matters planetary health?
Yes, thank you so much for asking that question. Yes, the education of healthcare professionals, whether they are physicians, nurses, or other healthcare professionals regarding climate change and health, is of utmost importance, because we as healthcare professionals cannot recognize and then address these issues if we're not educated in that. So, for example, I graduated from medical school in 2004. I had never received even 1 hour of education in 4 years of medical school on the impact of climate change on health. Even now in the United States, it is not mandatory from the national regulatory body to teach climate change in medical schools or in graduate medical education in the residency training. However, many schools have already done that. And in the US, in many European countries, in some parts of Australia, and in some other parts of the world, for example, in parts of Asia, the common theme is that are the students and the trainees who are demanding that they learn about the impact of climate change on health. They're the ones going to their school or their program administration and saying, we want this education, we need to know this education. And so that's how change is happening. It's very interesting because, when we go to the regulatory bodies, it seems that no matter where you are in the world, it is the same response. And that response is, we have a limited amount of time for the education, and we don't have any room to put this in, because if we put this in, then we have to take something out because we don't have enough time, and we're not going to lengthen the time of the education. The problem with that thinking is that climate change and health is not a separate subject. It is not like you're teaching a new course in nephrology or cardiology. It is integrated in everything that we do in medicine. So, for example, when you're learning about cardiology and you're talking about heart failure, you're talking about myocardial infarction, you talk about all those factors that cause that, but you also include what are the effects of climate change, whether that is heat, whether that is air pollution, whether that is vector-borne illnesses, whether that is mental stress. All of that can be integrated. And so I think working with organizations throughout the world, outside of the regulatory bodies, outside of government, to provide that education on a somewhat elective basis, but also to convince the individual programs to teach that is very important. The most important thing, though, I think, is to teach the practicing physicians what is the connection between climate change and education. And that is for two reasons. Number one, they're the ones teaching the students and the trainees. If they don't understand it themselves, how are they going to teach the new students and the residents? Number two, the majority of the healthcare practitioners throughout the world are not the students and the residents, they're the next generation, is all those people who are practicing, and they're practicing in the communities away from the academic centers. So they're not getting that education on a regular basis, but they're the ones that are seeing the effects of climate change on health. They're the ones that need to be educated. That, I think, needs to be done in many different ways, depending on the location in the world, depending on the system, on whether you do continuing medical education, professional development, you do seminars, you do online, however that is. But I think that needs to be marketed and promoted to practicing physicians, that this is important for your patients. This is new education, new science that we've learned since you graduated from your training, and you need to know this to be effective in your care of patients.
Thank you so much. If you have any question, you can write it in the Q&A session. I have 3 questions that I would like to ask. Number 1 is from Shilpa Mulki. She says, thank you. This is quite a brilliant intro to the topic. How can we be guided to conduct research on the impact of climate change on non-communicable diseases in Kenya that will help us make policy in that regards?
Yes, so
okay,
yeah,
you can start with that, then you do the next one.
Sure. So let me just quickly answer that one on how you conduct research on climate change on NCDs in Kenya. What I would recommend is look at the rates of hospitalization or increased acute care visits in the office or the clinic for non-communicable diseases, and see if there's any trend or relation to how the climate has changed. So for example, in the middle of summer, let's say July, August, if it is very hot on certain weeks, are you seeing more cases of people coming in with kidney failure? Especially if those already have, let's say, chronic kidney disease stage 2 or 3, and now they're coming in with acute kidney injury on top of that. Also look at decompensated heart failure. Doesn't matter whether it is systolic or diastolic. Look at, are they had increased risk of stroke? Is their blood pressure increasing? But nothing else has changed. They're still following the diet recommendations or not following, but it's consistent. They're still taking the medications as recommended. So how has that changed? What is the only variable that has changed? And if you have enough of these cases, you can publish those and say, okay, look, in Nairobi, we have seen this happen on these particular days. We have seen that, okay, if there's air pollution in this part of Kenya, and when they're doing certain types of industrial activities, we see the rates of asthma go up. We see the rates of hospitalization. We see the rates of needing rescue inhalers go up on those days. And then when that wanes down, the rates come back down to baseline. That's how I would approach that, because if you have the data and the research, then you can present it to the policymakers and say, look, this is what is happening. This is clear data. This is why we need policy to change this. So that's how I would approach that. We actually did some of this in the US. I know they've done some of this in Europe as well. They've done some of this in Japan and even in India, actually. I remember a few years ago, there was a very impressive presentation given at the UN headquarters by a pulmonologist in Delhi. And he was describing how the rates of asthma and lung cancer, especially in young people in their 20s and 30s, have skyrocketed as the rate of pollution has gone up. And there has been no other changes from a genetic perspective, from a migratory perspective, from a lifestyle perspective that should cause such an increase in those rates at such a young age.
Thank you so much for tackling that, especially the having talked about the issue of research and the role of actually sharing best practices, and also the role of research in trying to inform policies.
Yes.
There's a question that has been brought up by Odongo Odio. How does this health approach in COP? How does this health approach in COP how is it different from the radical reorientation of healthcare systems towards primary healthcare? Can we implement political declaration during UNGA, September 2023, which probably has more comprehensive and covers more on climate change?
So if I understand the question, as far as primary healthcare, I think this, addressing the health effects from climate change goes directly to primary care, because who are the physicians who are going to see this first? Who are the ones that are going to see this most often? It is going to be the primary care physicians. So they're the ones that need to be educated on this the most, need to be advocates to address this from a mitigation and adaptation perspective, and to change the healthcare systems if necessary, so that there are more primary care services available, including prevention, education, follow-up, and monitoring. So I think this actually goes right hand in hand with primary healthcare and the importance of increasing that. As far as a political declaration in September 2023, again, it's a declaration. It's similar to what happened at this COP. Declarations are nice. The important thing is action and what is being done regarding that. One of the things I didn't mention that we have advocated for from the healthcare community, at least for the last 3 years, and especially this year, is that we've advised countries that when they come out with their next NDC report in 2025, that they should voluntarily include health in that as a separate category, so that they can assess and the world can assess how Number one, climate change is affecting health. Number two, how individual countries are addressing that or not able to address it. And number three, where are the gaps in implementation, finance, and cooperation to address that problem. So I think that part of the political declaration, whether in September 2023 or earlier, or even at COP last week, that's going to make more of an impact than just a declaration saying that people are going to do more for climate change.
Great. Thank you so much. Having talked about the issue of declarations and how declarations are probably ratified and those who commit to declarations, that brings me to one question that I would want to probably get your view on. At COP28, we have had the climate and health declaration, and many of the ministers, like you've rightly said, we had very many of them for the first time attend. And we are currently having over 140 countries that have committed to that health and climate change declaration. How can we probably hold leaders accountable so that these declarations are not just made, but they can be able to be effected so that we have a community that is built to be adaptive and resilient, especially with climate change effects. As you think about that, there's a question from Dr. Joyce Chege, who says, "Hey, my name is Dr. Joyce. I am recently a graduated general surgery resident. My question is, Kenya being a lower middle and income country and resources directed towards health being limited, how can one leverage green points towards healthcare financing?"
Yeah, that is a difficult question. I think it needs to be done more on a local level and an individual system level. What is needed? So let's say, for example, the issue in one town or in one village is consistent and reliable power that is not fossil fuel derived. So what can be done, for example, is solar panels. If wind is an option in that area, use wind power. And one can approach the government, one can approach NGOs for help in financing that, to show that, this will actually improve health outcomes because you can increase the access to care for the local citizens, but also you can increase the type of care and the level of care that you can provide because you have reliable power. Same thing goes with water. If there is an issue with transport, can there be a way to have lower emission vehicles used to transport patients to different centers? Let's say you have one main hospital and then you have some satellite clinics. Is there a way to transport those people? If the issue is having available equipment or having the available specialists, how can technology be used, for example, telemedicine? In that situation. But then that leads to, okay, how do we make sure that we have reliable power? How do we make sure that we have reliable internet communications for that? So I think it really depends on individual circumstances rather than saying, okay, this is what we're going to do on a national level. That may work in some countries, but my suspicion is in many countries, even in high-income countries, taking a one size approach to the entire country may not, number one, be effective, number two, efficient, and number three, practical. And then going back to your previous question about how do we hold the policymakers accountable, I think there's two things. One is to keep in contact with them. So if you know somebody in the ministry, keep a dialogue with them. Let's say once a month or once every 2 months. Hey, what is going on? How can I be of help to you? How can I be a resource to you? And say, okay, this is what has happened in my town. What is the government going to do? What can the government do to help in this situation? How can I be a resource to you? That's number one. Number two is to advocate to make sure that healthcare professionals are involved in all areas of government at all levels of government. So for example, when the Ministry of Transportation is talking about, changing the roads, cutting down forests, putting in, let's say, a mass transit system, bring in healthcare professionals. and healthcare professionals can say, this is why this is important. This is why you need to do this, particularly in this part of town, because there's no green spaces there, because the air is worse there, because we're seeing those people coming in for lung diseases more frequently than others. When it is the Ministry of Health, advocate that healthcare professionals are involved in whatever policies they create, so that there's actually a medical expertise and opinion involved in that, and it is not just from a politician, a business person, economist. You're not just looking at the financial perspective of this, but from the healthcare angle, the health equity angle, and from the individual patient level as well.
Great. There's a question from Daktari Litha Musili, who says, as a psychiatrist, I'm interested in knowing how myself and other medical practitioners can participate in COP.
I think there are many ways. There are NGOs that are involved in COP. There's been many universities that have been involved. So let's say you are academic at a university, see if your university has a recognition to attend COP, and if so, then go to your university and say, hey, can I be part of this delegation that advocates for climate and health at COP? If you're not part of a university, see if there's NGOs there that have a national office, and see if you can participate in that. From the government level, that may be more difficult. It depends. I think it depends on the country, how medical practitioners can be involved at the government level if they are not already employed by the government. But I think there's many different ways. The one thing I will say is that, let's say that you are part of an NGO that wants to participate in COP. From my understanding, the application process may take 2 to 3 years. So if they're not already recognized by UNFCCC and have a certain number of delegates to attend COP, it's unlikely you'll be able to attend COP29. It may be COP30, COP31, but it's still a process, because this doesn't end with COP28. This is going to continue, and we're going to have to refine and advocate and evaluate and change what we say about the health effects from climate change.
Thank you so much. Maybe just to add on to what you said, participating in COP levels, perhaps this doctor wants to probably attend and even see what happens at COP. First, you need to have accreditation to go to COP. And there are several organizations that usually are given accreditation by UNFCCC to be able to give you budgets to go. That is basically a leeway to enter into the conference. Then through that, you can also use that to look for funding. So there are many organizations that may fund you to go to COP. If you're a psychiatrist and maybe you want to talk about the nexus between climate change and mental health, then you may look for organizations that champion for mental health or champion for climate change and health. Then they can be able to fund you to probably give a study that you've done, or probably give your perspective on the impact of climate change on health, especially mental health, among probably communities in Africa or communities in Kenya. Just to add on that, there's a question from Agan Leonard, who says, thanks for the elaborate presentation. What is your opinion with regards to greenhouse gas emission, which is central to 2015 Paris Agreement up to today? How can we ensure that these declarations are effected, more actions as opposed to annual declarations?
That is the question. How do we make sure that that these actions are actually fulfilled, rather than these countries making these declarations or these promises every year? It's very interesting that you asked this question, because I had this exact discussion for quite some time with the director of climate change policy for the United States government at this last COP. He's also a physician, and we were both quite dismayed by this fact. I'll tell you what he told me, and then I'll add on to that. What he told me is that this is exactly why the healthcare community worldwide needs to be more active, advocate, and demand change at their national government level, as well as at the global level. It starts at the national government level, but if you have contacts at in other countries, then you can advocate to them as well. But I think that's what needs to be done. Number two, is to show the evidence, the data about why this is important and why we cannot allow the ongoing increase of greenhouse gas emissions. I think that's how we convince these countries to actually take action. The biggest hindrance is the lobbyists. At this year's COP, there are estimates that there were more than 2,400 oil and gas lobbyists from various sectors and companies and organizations at COP. This has been a problem every year at COP for several years, and this year it was more than any previous year. They obviously have more resources, more money. They can fight, and they can work towards their interest, which is not stopping not stopping oil and gas production, which leads to greenhouse gas emission. So this is the challenge that we have. So the only thing that we can do is show the data, advocate for our patients, advocate to the government. That's what I recommend.
Thank you so much, Doc. There's a question from Japheth Samson, who says, as an orthopedic surgeon, is there any qualifications for orthopedic surgeons to join?
I'm sorry, to join what?
So probably the movement, or because maybe they're talking about, is there a nexus between climate change and what they do?
Yes.
As orthopedic surgeons?
Yeah, I would say definitely think about when there are severe floods or there are hurricanes or typhoons, or there are forest or bushfires. What happens when people try to run or when there's destruction of property and they are injured? So I think, yes, it definitely affects them. The other factor is the food systems and water. If you're not getting nutritious food because we have destroyed the soil, or because we're doing monoculture, or because the ground has been stripped of its nutrients for different reasons because of climate change, then obviously our bones are not going to be that strong. The rest of our body will not be strong, our immune system. So that, yeah, definitely will affect orthopedic surgery. I think it affects every specialty that there is. Even, I would argue, even plastic surgery, since they do a lot of wound care and wound revisions, because obviously your immune system has gone down. It'll affect wound healing also. So I think it affects every specialty, and that's why I think every healthcare professional has a role to play in climate change at the local level, national level, or global level. I don't think it's absolutely necessary that you have to think that, oh, I need to be involved in COP or at the global level, because everything starts at the local level and at the national level. That's where the change happens. At the global level, it's more consensus from what people have seen in their own countries.
Great. Thank you so much, Doc, for that presentation. I'm trying to check if there's any more question, but I'm not seeing. Probably just to pick from what you've said on the nexus between probably climate change and the other cadres and the different specialties that medical professionals have. So clearly you can see that there's a huge link between climate change and our various specialty, be it whether you are an orthopedic surgeon, whether you are a psychiatrist, whether you are an internal medicine physician, there's a whole link. And that's why KMA decided to come up with the Planetary Health Committee, so that you can be able to increase awareness on this nexus between climate change and health, be it in our cadres, be it at the community level, so that you can be able to build an adaptive and climate resilient community, but also build a healthcare workforce that can be able to respond to those climate change or climate induced health risks. So on behalf of KMA, because of time, I would want to thank all of us who found time to be part of this webinar. I believe we'll be able to learn a lot. And thanks to Doc for getting time to be able to speak to us on the impact of climate change and health, and also tell us about the COP processes, what happened at the first or the inaugural COP Health Day. On behalf of the committee, I would like also to remind all of us that the committee welcomes all medical practitioners who are part of KMA, who would wish to be part of this planetary health movement, that next year we have a whole array of activities that we are lining up to be able to impact our society and to be able to address this nexus between climate change and health. And therefore, if you're interested, please reach out to any of the KMA Planetary Health members. We have Dr. Beatrice Mulu, who is the secretary of the committee. We have Dr. Atea, we have Dr. Wairimu, Dr. Annette Odhiambo, and Dr. Masika, who is the vice chair of the committee. If you have interest, and I believe you know some of these people, then you can be able to reach any of them, and therefore we can be able to plug you next year in many of the activities that we're able to do. Recently, we had a climate and health special med camp that we did at Kitengela. And those who know Kitengela, you know that Kitengela is known for air pollution and dust pollution. And there's a close link between climate change and air pollution. WHO actually is focusing so much on air pollution when it comes to this nexus. And currently we are seeing 7 million deaths annually as a result of air pollution. And when we went there, we were shocked that many of the patients that we saw, and we were able to see around 1,200 patients in partnership with some 2 other organizations. Most of these patients who had respiratory conditions, including exacerbation of asthma, did not understand the nexus that this dust could have been probably part of the exacerbation of their conditions. So you can clearly see that many of our communities do not know what is happening. They don't even know what climate change is. They don't even know what COP is. But we believe as healthcare practitioners, we have a role to play in trying to impact and change our society. We have a role to play. There's a study that shows that healthcare professionals are actually trusted members of the community. And therefore, if you can be able to get this knowledge, then you can be able to transform our healthcare system. Kenya, for example, graduates around 1,000 doctors every year. And these 1,000 doctors, just imagine if all of them had a little knowledge on planetary health. Some of them will go into policies, others will work into the ministries, some will go into practice, some will go into businesses, and some of them will even become presidents. So we have a role to play, and we have a huge role as Planetary Health Committee to be able to impact our members to understand this nexus. So on behalf of KMA, on behalf of World Medical Association, whom we are partnered with to get this webinar done, I would wish to thank you all for finding time to participate. I don't know if Doc, you have a final word before we close?
No, I think you did. This is an excellent presentation, excellent work by you, David. And I'm so happy that so many people had joined. You all know that this is a very, very important issue that all of our patients face. And as has been said by many people over the years, climate change is probably the biggest public health threat facing the world in our and future generations.
Great. With that, we will end our session, and I believe we'll be able to have many more of these sessions so that you can be able to drive this agenda. Thank you so much, and bye, everyone.
Thank you. Bye-bye.